Okay, so my name is Keith Hoolihan, and I've been using the OVCs for perhaps 3 years now, maybe a little bit longer. I use them, and it's a little bit sad, some of the reputations perhaps of the One Visit Crown. It's a little bit harsh on the technique, but I initially started off choosing teeth that I thought had a hopeless prognosis, teeth that I thought I couldn't do anything else on, teeth that weren't worth spending any money on to root fill and put a crown on, a conventional crown, and teeth I thought I'd have just the devil's own job trying to build up in a composite because there was nothing left. I'm talking teeth flattened off at gum level. And to my absolute amazement, the One Visit Crowns did stick on there and they have stayed on there. And that gave me a lot of confidence to then start using them instead of big composite fillings. So when a patient comes in with a broken cusp off a tooth and they're expecting a couple of visits and a big expense, I found I can get a One Visit Crown on there in about 20 to 25 minutes. Yeah, I've been really surprised actually about the One Visit Crowns. I've had people come in, patients of mine, and I wouldn't want to be doing this on brand new patients, but I've been in my practice for 30 years and they trust me. So I look at that tooth and I think, I'm going to have to take this out. And they say, Keith, is there something you can do? And I say, well, I don't want to spend any money on this tooth. We don't want to spend $2 or $3 grand on this tooth. It's not going to work. And they said, is there anything you can do? To get a matrix band on some of those broken off roots is just about impossible. But every so often I've managed to get a bit of the band on and get an OVC on there. And I mean, okay, it's the days, they're back a couple of years later and the things they're still on there. I almost can't believe that. So I'm really very happy with them in that situation. And then I started thinking to myself, well, if they're working in that situation, then when there's about 2/3 of the tooth left above gum level, that's even easier. And in fact, they're as quick as hell to do, where there's plenty of tooth left. It's a really simple thing, isn't it, really? I mean, they're always going to pick the option in the middle, aren't they? If you offer them something called a filling, let's say $400, and a conventional crown where you have to put their tooth in a pencil sharpener for $1,500, or this one in the middle for $750, $800, where you just stick it onto what's left and it does no damage, they're always going to take that. So it's a pretty easy sale. And I just find that the patients respond to them very well. Afterwards, when you've got the crown on there, particularly if it's in with a broken tooth and they think they're looking at, oh my goodness, this is going to be really expensive. I'm going to have to come back. Maybe I'm going to need this. Maybe it's going to be a root canal. And actually, if half an hour later they're walking out the door with their crown on, I've had businessmen who are in the dental industry, guys that manage some of the big dental supply firms around Auckland, patients of mine, I've had them get out of the chair, look in the mirror and say, that is the holy grail of dentistry, isn't it? And I just go, oh, yeah, pretty easy, really. People are amazed by them. I like them, and they like them. Well, I think it's easy to present an option that you're happy with yourself. And when I look at the margins of them and I see them coming back now over 2 or 3 years, and I don't think I've had a nerve play up underneath one. I mean, it's a pretty great technique. Yeah, I think it's cost and I think it's time, but also I sort of think the era has gone of removing more tooth tissue. I just having, as I say, been in the same practice for quite a long time. Some of my biggest regret are the mouths that I took a lot of enamel away on 25 years ago and put crowns in, because when they start failing, it's very, very difficult. You're now down to root, you're now down to posts, now down into recurrent decay, and you've got this kind of liability of tens of thousands of dollars of work that you've done on these patients sitting over your head. OVCs don't have that liability, and they seem to me to be pretty simple to repair. I'm just thinking to myself, this is a nice thing to do. I think the patients turn down crowns because of the cost and because of the time and because of the discomfort. And I also think that dentists are getting a little bit more wary of selling them. Yep. Certainly the One Visit crowns have been good for the bottom line. You don't sort of have repeat work, as it were, if someone sort of, if the crown comes back and it's broken or doesn't fit. I mean, the OVCs are very easy to patch up and fix should something go wrong, I imagine, because they're only composite. But essentially the reason it's been really good is because you've got something to do on those hopeless teeth that'll help keep the patients happy. And happy patients send their friends in. They send people in who are getting lined up for standard crowns to have One Visit crowns. Now what I do with the root fill tooth is after I finish my root filling, put the composite in, Everex, whatever, into the root canals, put the matrix band on, and put my OVC on straight away. I like them for root canals, yeah. I think that if you put a conventional crown on there, you're actually taking a lot of coronal tissue away. You're actually weakening the tooth. Just overlay them. Keep whatever tooth tissue you can.